Sorry about that. So yes, thank you all for joining us today as we launch the Train to Trainer series in partnership with the California Hawaii NAACP. As I mentioned, cancer is a disease that affects everyone, but unfortunately, it does not affect everyone equally. And that can be said for the Black community. With the shocking cancer statistics among Blacks, it is vital that we raise awareness and continue to promote prevention and detection in our communities. Today is just one step closer to hopefully reaching more within our communities by arming you all today with resources to spread the word. We are very, very excited to partner with the California Hawaii NAACP on this important initiative. And I wanted to take a moment to introduce the California Hawaii NAACP President, Rick Callender, who will share some remarks. I'll turn it over to you, President Callender.
All right, thank you. Good evening, everyone, and Happy New Year. And thank you, Jen, for kicking this off, and thank you for your introduction and your hard work in pulling this great event together. I want to thank everybody who's attending today, and I'm glad that you've taken your time out of your evening for this important discussion and the trainer. And the California Hawaii NAACP, we're truly honored to be able to partner with the American Cancer Society. And I look forward to doing our part to help increase awareness and the education that will undoubtedly save Black lives. You know, I appreciate the American Cancer Society's commitment to supporting cancer patients, funding research, and educating the masses about cancer and cancer prevention, because your efforts are truly commendable and they're truly needed in our community. When this idea came up about a possible partnership between American Cancer Society, I have to tell you, I jumped at it because it made sense for us to work together to further our reach, especially given the statistics that put our community at a disproportionate high risk of cancer diagnostics. So this model is going to be effective because our local branches, we're the ones that are on the ground. We're the ones in the ground in our communities. We have influence and we're the hubs of information for the Black community. So this puts us directly on the front lines of cancer advocacy for our community. I truly think that this is going to be a great platform to help educate the Black community and all communities of color to help them make sure that they have access to close the information gap about cancer. Thank you to our health chair, Cedric Spencer, for coordinating this very important opportunity for the California Hawaii NAACP to learn and to provide tools for our community. And I also want to thank the NAACP staff for your work in supporting tonight's efforts. But I hope that each one of you will leave with a renewed commitment to be a conduit for change. We'll be hosting these meetings quarterly, and I hope that you'll invite your friends, your family, your colleagues, and other communities to participate. So again, thank you to everybody. Thank you for your time. Thank you for your commitment in attending. And thank you to the American Cancer Society for teaming up with the California Hawaii NAACP to make this happen. Thank you. Back to you, Jen. I'll turn this over to you to keep this going.
Okay, I don't know about you, but if that doesn't fire you up to start spreading the word about cancer awareness, I don't know what does. So thank you so much for that, President Callender. As we mentioned, these are going to be quarterly trainings as an opportunity for us to not only educate you, but arm you with the resources to spread the word within our communities. So today's session is going to focus on health equity as it relates to the Black community. And for the American Cancer Society and ACS CAN, health equity means everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. So after today, we hope that you'll be able to spread the word. So promote, have these resources and share it, get involved within your community, because it's not just about our voices, but the voices of the larger community as a whole. And most importantly, get screened. If we're not getting screened, then it's almost impossible for us to be able to decrease these mortality rates. So leading today's session is Ashley Brown, who is the Strategic Director on Health Equity for the American Cancer Society. And this is really meant to be an interactive session. So if you have questions, if you have comments, feel free to jump in at any point, put it into the chat. It's really meant for us to not only educate, but to answer any questions that you may have at any moment. Also, we do ask that when you aren't speaking to please mute yourself so that there aren't any interruptions within the training. It is being recorded, so following this session, you'll receive the resources, materials, as well as a recording of this session following tonight, as well as a survey. And we do ask and hope that you take a moment to fill that out with just what your thoughts are on this first of the 4-part series. So thank you again. And with that, I will turn it over to Ashley.
So good evening, everyone. Again, my name is Ashley Brown. I'm the Strategic Director of Health Equity at the American Cancer Society. I feel so grateful to be with you all here this evening. I am based here in Atlanta. So if you hear me stumbling over words or anything, blame it on the time difference, but I feel very, like I said, very grateful to be here with you all and share a little bit about health equity, ACS's journey, and how you can come along on that journey with us. So I'm going to talk a little bit about why health equity matters to the American Cancer Society, what ACS and ACS CAN, which is our advocacy affiliate, what we're doing to advance health equity, and then finally, what you can do to advance health equity. And like Jen said, I hope this is an interactive session, so please come off mute when you have questions or type things in the chat. I really want to hear from you. Before we get into me talking a lot, I want to share a brief video with you all from a very special volunteer. Her name is Jamil Rivers. So hopefully you all can hear it, and please let me know if you can.
In 2018, I was diagnosed with metastatic de novo. It means the breast cancer has already spread throughout the body, so stage 4 from the start. I was devastated. I broke down crying. The first thing I thought of were my kids. My youngest was in kindergarten at the time, and my husband had already gone through colon cancer diagnosis and treatment. So I'm gonna have to figure out how to work full time, how to go through chemotherapy, how to take care of myself, not overwhelm my husband, and still take care of my kids. I didn't know what I needed or didn't. I just knew I had breast cancer, and so I need to call and figure out how can American Cancer Society help me. And I ended up calling the hotline, and I said I want to take advantage of everything. They just helped and connected me with everyone in my area that could support me during my cancer journey. Initially, I was just thinking about surviving. You're just focused on what you have to do. Going through my cancer journey and then meeting other women, and then coming literally in my chemo room and just poking in and saying, you know, you look like you're doing all right. Can you share with me what you're doing so I can, you know, learn? And then I got involved with the American Cancer Society's Health Equity Champion program. That's how I met other people, and we are working together, collaborating together. I'm sharing what I know, they're sharing what they know. And I did notice the pattern. You know, I noticed that, you know, with the Black women that I was connected to, they were running into barriers. They were running into challenges just to get standard level of care. For the most part, Black women are dying at a higher rate of breast cancer. We're also diagnosed younger. We tend to be diagnosed with more aggressive breast cancers like triple negative breast cancer. We tend to metastasize sooner where it spreads. Yes, there are social economic issues, but the most recent research shows that it's due to provider bias and structural racism. If we were to just have level, standard, equitable, accountable care across the board, we could reduce the death rate by 30%. There are some cultural issues as to why the Black community doesn't communicate about cancer as often during our.
So I'm gonna stop it right there, but I wanna hear from you all. What resonated with you about Jamil's story? And actually her husband, Rick, is also a colon cancer survivor. What does health equity mean for you? What did you take away from this video?
I think to me, the most important thing is not having the resources in our community to go see a doctor, and better yet, even a specialist. I mean, I was on Medi-Cal for 2 years, and getting into any specialist is like a wait. Like I had to wait almost a whole year. So a lot of times, other people who are middle class or even at a higher level have access to all that, where some of the communities where we work at don't have that access.
Mhm. Yeah. Yeah, I think Jamil pointed that out and you did as well, that access to care is so important. In fact, if we close the access to care gap, that's one of the ways we can ensure Black people, people of color aren't dying of cancer. Anyone else? I see some hand raised. But
Selena, let's go to Selena next.
Thank you. I think healthcare equity really also has to do with having access to information, so you know how to navigate your healthcare needs.
Yeah, that's so important, right? And I think we're going to talk about that here some more, about how can we empower ourselves. I think Jamil pointed out some of the systemic barriers and provider bias and all of these things that may be stacked against us, but how can you kind of arm yourself with information, arm your family, your friends with information so that they know what to ask when they go to the doctor's office or how often they should go to the doctor. Those are the kinds of things that are so important. Anyone else want to share their reactions? Okay, well, Jen will definitely share this video with you all after the call, but like I said, Jamil is a volunteer for the American Cancer Society, and as value folks on this call as well, we like to uplift those stories, especially for communities of color. So what is health equity to the American Cancer Society? As Jen said, health equity means that everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. There are lots of definitions of health equity out there. In fact, our partner, the Robert Wood Johnson Foundation, who funds some of our work, they define health equity as meaning that everyone has a fair and just opportunity to be as healthy as possible. They go one step further and say this requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. It is very important to state that equity is not the same as equality. Equality is providing everyone with the same tools and resources, while equity is providing tools and resources based on needs that allow everyone the opportunity to be as healthy as possible. So I always like to start with the definition because it kind of level sets so we have a clear understanding of what we mean when we're talking about health equity. So why does health equity matter to the American Cancer Society? We know that our mission is to save lives, celebrate lives, and lead the fight for a world without cancer. And if you put a health equity lens toward that, that means that no one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, their gender identity, their disability status, or where they live. And we felt that it was so important to really state these and highlight the communities that we serve because the mission as it is very general. It applies to everyone, but making sure we're calling out folks who experience those disparities is equally important. So what do we know about cancer disparities in the Black community, and what do we want you all to know? Like Jen said, we know that cancer is a disease that can affect everyone, but it does not affect everyone equally. We know that overall, cancer mortality is actually decreasing, but the socioeconomic disparity in overall cancer mortality is actually widening rather than narrowing. And when we're talking about the Black community has the highest death rate and the shortest survival of any racial and ethnic group in the US for most cancers. The death rate for all cancers is 20% higher in Black men and 14% higher in Black women than their white men and women respectively. Breast cancer mortality is 40% higher for African-American women in the US than for white women. Living in Atlanta, this is actually true no matter your income. Prostate cancer accounts for 30% of all newly diagnosed cancers for African-American men. 1 in 7 African-American men in their lifetime will be diagnosed with prostate cancer versus 1 in 8 men overall. And Black men have the highest cancer death rate of any racial and ethnic group in the US. We also see disparities between those who have health insurance and those who don't, and how often they get screened for cancer. And we also see geographic disparities as well. I think it's really important to point out that those living in rural communities, especially in rural communities and being a Black person, have limited access to healthcare. So just these disparities are stark. Every time I look at them and read them, it always hits home for me. How many folks on the call were aware of them or where they existed to this extent?
I can just speak for myself, and I know that prior to joining ACS, I was not aware that it was this stark. So seeing the numbers and hearing more about it, it was really shocking, especially because health isn't something that is discussed at home. You don't really talk about it. So knowing that these are the numbers and no one is talking about it, that also leads to a lot of confusion.
Yeah.
I didn't know it was that the numbers were like this. And I was sharing with Jen a couple of weeks ago that my uncle was recently diagnosed with cancer. And so it's kind of made me have to throw myself into doing some research. So when I got a little bit of information from Jen, because I mean, it's like perfect that we connected at this time. And I began to see this is a really big deal for our community, and definitely something that we need to be advocating for.
Stacey, I see that you raised your hand.
Yes. Hi. I basically knew the numbers were this high. I'm a recent cancer survivor, so I learned a lot of things about the disadvantage of people of color or Black people being diagnosed. But that's the worst thing that I encountered is going to the doctors all of this time, thinking that we were getting our regular checkups and all of that, when basically when you went to the doctor, the things that I know now, you were not told. So it's the lack of information that could have prevented, like we don't have the information that maybe other people have, which I don't understand, because of the information such as the vitamin D or the information about how, especially breast cancer, there's things that we should have known that they should have checked way a long time ago to prevent or to catch it in time. That many women have died because of that lack of knowledge.
Yeah, that's absolutely correct. I see that a few more people have their hands raised. If you want to just come off mute.
Hi, my name is Leslie, and I'm here in the Bay Area. And wow, when I see these numbers. And I think about clients that I currently serve. I'm a board certified health and wellness coach, and I definitely appreciate what the previous speaker shared, because there is that gap. It's a gap from two things. One, I think, is that the information, but also knowing what to ask when you're there. Some of you on this call know that when you go for your annual physical and you have your blood work, vitamin D is not automatically in that lineup, the write-up of everything. You have to ask for that separately. With some health plans, that's another thing. It's not automatically like it is checking your glucose and LDL and HDL. The other thing is the gap with the coaches. I know Kaiser is doing more work in that area, and I'm hoping other healthcare organizations will begin to do that, because people need a bridge between wow, I'm pre-diabetic, or wow, I just have cancer. What do I do? How do I get there? Where do I start? And that's where health and wellness coach come in. Someone who's certified that understands, not telling them what to do, but knowing how to figure out what the barriers are so that they can get to a place of movement toward thriving, even in the midst of the diagnosis. Thank you.
Yeah, no, that's absolutely correct. I think one of the strategies for reducing disparities is having patient navigators, right? Just like you said, having someone within the system who can navigate you to what comes next is so important. And Monica, I'm going to call on you.
Thank you. I think something that I would like to know or get more information on, the numbers are like crazy, but something that I have a few friends who are cancer survivors, and some of them have pointed out that like I have 3 friends who were breast cancer survivors, and the same story I heard was, I knew something was wrong. I let my doctor know, but because of the age, they didn't listen and they didn't do a mammogram. And when they did check, it was a little at a higher risk. So it's more of like maybe knowing how to advocate for them, and knowing that if they feel that something is off, and who knows our body more than ourselves, right? How do we move from, okay, no one's listening to me, what is my next step, so that I could be heard and I could get the healthcare and the services that I need.
Mm-hmm. Yeah. One, that is so important, being able to advocate for yourself, getting a second opinion if that doctor is not really appreciating your perspective. And like you said, knowing you know yourself better than anyone. And also, we also have a hotline here at ACS. So if you have questions about cancer or how to talk to a provider, they can answer those questions as well. So that's one thing that I don't think a lot of folks know, is that there is someone to talk to when you're trying to figure out what happens next. Our folks on our hotline can answer those really difficult questions. And that means if you're like getting screened for cancer, or if you just got a cancer diagnosis, you can always call us. So I'm going to move on for the sake of time, but thank you all for sharing your stories, especially to the survivors. The next slide, I mean, I'm sure you all know this, but thinking through kind of the social determinants of health. So I always say that I don't like data without context, right? So we know that these disparities exist, but they exist because of these social determinants of health. They exist because of the conditions in which people born, grow, live, and work, that are shaped by the distribution of money, power, and resources at the global, national, and local levels. And thinking about transportation, housing, we talked about access to quality healthcare, financial stability, food security, the physical environment, education, all of these things that impact our health, that we know actually impact our health more than what happens outside of it, what happens inside of the doctor's office. Thinking about these things, again, another question for you all: what social determinants in your community or where you live may be having an impact on health right now? I know we're living in a pandemic, right? So that is certainly shaping our health outcomes. But when you think about your community, where you live, what are some of the social determinants that are impacting health? And that could be cancer or health more generally.
Food deserts, would that be one?
Yes, absolutely, absolutely. I mean, we know one of the risk factors for cancer is obesity and inactivity, and then so we have recommendations here at the American Cancer Society for folks on being active and eating healthy foods. But if you don't have access to those foods, what are you supposed to do, right? So that is definitely one. Anyone else have thoughts about this?
Let's go to Maria next.
Hi, everyone. My name is Maria Alcazar with Stand Affordable Housing Program Supervisor. And I wanted to say that, first of all, I'm a 12-year breast cancer survivor, and I can totally relate to all the stories that have been shared. And the number one thing that really, really helped me through my journey is being able to connect to a cancer navigator. Mm-hmm. And that literally, I feel like that saved my life, because although I was connected to a navigator and I was referred and, was given that support as to what to do and how to do and with what doctor to go to, there were some instances that I still did not understand certain things, right? So in the midst of my process, my journey, I switched doctors because I started to learn to do research and advocate for my own self. And I was finding myself without, with no intent or disrespect to anyone in the medical field, but I started to ask questions. And that was not the norm. They were not used to someone asking questions as to why am I taking this test? Why haven't this been done, and such. So I switched providers, doctors in the middle. And so that really opened up my eyes to knowing that not everyone is so privileged to know that there's certain systems in place to assist folks to learn to navigate, especially when you're being faced with such a diagnosis, right? And it's such a scary moment, not only for yourself, but for your family as well. So long story short, I am where I am now by the grace of God. And, but also going back to the social deterrence in our neighborhoods, and I have some staff on here joining the call, Monica being one, and Sharon and Luz, who are trust builders in the community and service coordinators for families. We work in a Southeast Stockton area, which is very low income neighborhood. And all the social deterrents that you're listing here in this slide, all those are extremely impactful in our area. Our residents are primarily African-American communities, population, and Latino farm working families. So we have a very high interest in this specific training because we feel that it could bring and make great impact in in the communities that we serve. So thank you for having us.
Yeah. Thank you for sharing. I think you pointed out something great. Well, a couple of great things about the patient navigators. The navigators within healthcare systems are so vital and important. Also, that these social determinants are all interconnected, right? You couldn't probably just cherry pick one and say, it's just transportation that's causing this issue, or it's just access to quality housing. They're all so connected, especially in communities of color. They're connected, they impact our health. And we see these play out on a daily basis. So I'm going to move on, but please feel free to share more information in the chat and we'll continue talking about this. Since we're talking about social determinants, let's take a look at some examples in Los Angeles County. This map actually shows late stage breast cancer among African-American women. The dark pink areas are the highest concentration and where large populations of African-American women live. Densely populated communities are historically underserved and disproportionately burdened by cancer and experience greater obstacles to cancer care, including complex systemic racial disparities. All of what we just talked about, right? All of the things that we just talked about, you can see it playing out on this map. And we know that the pandemic has exacerbated disparities, not just in other types of health outcomes, but also with cancer, right? You think about people delaying their cancer treatment, not just their screening, just going to the doctor's office, but their cancer treatment because of the pandemic. But also the pandemic has increased resulting job losses and further income insecurity with compounding health inequality and access to care. And there's a lack of access in clinical trials. I mean, if we're talking about where people live, racist redlining, and historic abuse and research, all of these things really lead to this, I hate to say perfect storm, but this storm, right, of disparities within a community. And that's what you're seeing in this map. And this map shows late stage prostate cancer among African-American men. The dark purple areas are the highest concentration and where large populations of African-American men live. So again, a similar map, a similar problem. And unfortunately, this issue has persisted for generations, right? And we're seeing it continue to play out. And I think like you've all stated, especially the survivors and others in the call, people are starting to hear more about cancer and how it impacts their families and their communities. So I'm going to talk about this briefly, what ACS is doing to advance health equity. I think in 2020, with the racial reckoning that a lot of organizations had, it was really important for the American Cancer Society to hold a mirror to ourselves and make sure that we're working in an effective way to advance health equity. So we developed these guiding principles for our staff and our volunteers to make sure that everybody was on the same page when it comes to health equity, because we can't work outside in communities with the people we serve in an effective way if we're not all on the same page, if we don't have a clear understanding of what it means to advance health equity. So we help people with the greatest need, embracing diversity and inclusion, understanding the communities that we serve, so understanding that entire context that we just talked about, partnering with different sectors and addressing the social determinants of health. These are the kinds of things that ACS staff and volunteers are committed to when it comes to health equity. And I just want to quickly point out some resources that are available to you. So we have these documents called Facts in Our Fight. So if you want to share more information with other organizations or with your family and friends about the disparities that exist within our communities, on the front page of this document, it highlights cancer disparities. And on the back page, it shows what ACS is doing so they can tap into those resources. This postcard here also has information and resources for your local community as well. But just knowing that these tools and resources are open and available to you as you kind of share more information and create more awareness about cancer disparities. And I'll also mention that cancer.org is a one-stop shop for all information as well.
Ashley, I think Antoinette had a comment or question.
Yes.
I wanted to unmute. Can you hear me, Ashley?
Yes.
My question was, this ACS, is the transportation, is that, I know I'm in Los Angeles, actually Long Beach, locally, and is ACS volunteer driven on the transportation piece? Because I run a support group, and often when there's transportation issues, I may have reached out, but I believe is it volunteer run, the transportation piece with ACS?
Yes, it is. It is volunteer run, volunteer led in partnership with ACS staff. So yes, our volunteers drive folks to their cancer treatment appointments.
Yes, but at times I could not get anyone based on it being volunteer driven. That's why I was asking the question. I thought maybe that had been modified or changed.
It hasn't changed as of yet, but I will say that we have a new leader coming on board who will be kind of taking a look at our programs and seeing what communities we're reaching into and what communities we may be missing, and how we can do a better job of increasing, like you said, rides in the communities that aren't getting them. So I'm hoping that through that process, we will make sure that we reach out to all communities. And I think as an ACS staff person, Jen can also help connect you to folks who can make sure that those rides are being met in the communities that you serve.
Yes, because that was one of the determinant factors also that was not on the list is oftentimes fear. But my support group and some of the resources that we connect people with, we find that when people are stagnant with treatment, especially during a pandemic, it's often fear-based. So yeah, connecting survivors with other survivors for rides and some of the things that we, offer in terms of services. Also at our support group meetings, I was a little late getting on. We also have presenters that are quite often doctors and other resources. So that also helps bridge the gaps for navigation to screenings and just a variety of resources.
Yeah. No, that's amazing. I think if ACS can further connect with you in that work, we should certainly do that. So Jen, please take a note to make sure that we're connecting and making sure those rides are being met.
Definitely. Cedric?
Yes, thank you. So in my household, my mother typically takes care of my father. He has colon cancer, but she's always been the one to kind of lead the charge to make sure, my father and the boys were always, had their checkups and what have you. How do we empower men to take more control of their health, specifically around colon cancer with some of the numbers we just saw presented?
That's such a great question. And this is something we've talked about with other organizations as well, like 100 Black Men, and thinking through how we can empower Black men especially to take control of their health. So one of the things that we're doing is starting a campaign. It's through this actually Get Screened campaign. We're targeting specific populations to share more information. So one, that folks see themselves in the campaign. So you'll probably see a lot more Black men in our campaigns sharing more information about prostate cancer and colon cancer specifically. And we're trying to make sure we're engaging I hate to say, like celebrities and influencers who look like the people in our communities, right? Because we know that folks want to hear from people that look like them. We're also trying to tap in. We have partnerships with faith-based communities as well to make sure that those leaders have the information that they need to share with their congregations or whoever that they're serving. So we're doing it in a number of different ways, but really about messaging, marketing, and communications that folks have the information from the sources that are trusted, right? Because we can't just put general messages out there and expect those to really reach folks who look like us. We have to make sure that they look like the folks in our community. So that's one of the strategies that we're using. But we're also open to suggestions. So if you have a great idea about how we can further engage Black men, please share with us.
Yes, ma'am, I sure will. Thank you, Ashley.
And Stacy, I'm not sure if your hand is still raised or if you had another comment.
Oh, I'm sorry. My hand was still raised. Sorry.
No problem.
So I'll briefly just share that about our Get Screened campaign. So like I mentioned, because of the pandemic, we saw a drastic decrease in the number of folks who are going to the doctor to get screened for cancer, right? And so it was so important for the American Cancer Society to make sure that people know that they can get screened safely, wearing a mask, going to your primary care provider or your local community clinic, wherever, to get screened. We always say like the doctor's office is probably one of the safest places that you can go to, as long as it's not a hospital where you're getting treated with a number of COVID patients. But making sure that we are sharing messages about the appropriate ages to get screened. So I know I shared those numbers about cancer disparities, and Jamil actually shared her story. She's a younger Black woman. So we recommend breast cancer screening beginning at age 45 with the option to begin at 40, for example. Well, Jamil is younger than that, right? So when we talk about reaching out to our communities and making sure that they have the correct information, and you all brought this up on the call, it's really important to advocate for yourself. If you have a family history of cancer, you should be asking your doctor about getting screened, possibly at an earlier age. You should be talking about and having those conversations, because it may hit you or someone in your family much earlier than the recommended screening age. So it's so important for you to start those conversations, for your family members to start those conversations a little bit earlier. So I wanted to share this information and say, yes, we have screening recommendations and screening guidelines, but it's so important for the Black community, especially for colon cancer, breast cancer. If you have a history of cancer in your family, to start those conversations, to ask your family members if they've been screened. I know, again, fear, we talked about that, right? That's a huge issue, not wanting to bring up these cancer, the big C word, in a family conversation, but it's so important that we're all at least starting to bring it up within our family. So that brings me to what can you do? So spreading the word, again, we talked about that, promoting the importance of cancer prevention and detection, getting involved in your community, being an active participant in community-led solutions and amplifying community voices and experiences. I know since you're on this call that you're doing that already, but I'll just say, put a plug in for our advocacy affiliate, ACS CAN. We know that one of the greatest ways to close the disparities gap for Black communities and for other communities of color is to make sure that everyone has access to quality and affordable health care. And that is one of the primary things that the ACS CAN, our advocacy affiliate, works to do. So if you want to educate your local policymaker on cancer disparities in the community and what they should be doing to make sure that everyone has access to health care, I encourage you to get involved with ACS CAN and help educate your policymakers. And finally, get screened. I know I said it a bunch of times in this presentation, but early detection of cancer through screening reduces mortality from cancers. So encouraging your family, your friends, your colleagues to get screened for cancer is so important. And before I sign off, I just want to ask you all, how would you go about having this conversation with your family, your friends, your colleagues about getting screened for cancer? You know, I have a book club. We talk about all kinds of things, and including our health and how important it is for us to advocate for ourselves. But I want to hear from you. Do you guys have some ideas about how you would go about having this conversation of getting screened with your family or friends? Or if you've had the conversation before.
For me, with my family, we talk about this all the time, and sometimes it is scary. I have 3 girls and a son, and it is equally, it can equally affect all 4, correct? So, and then their children and their children's children. So I think education is the most important piece, and always trying to stay on top of the latest research information that can be shared amongst family members in a more simplified manner, but just continuing to encourage them to get their early checkups, to stay on top of their symptoms, to do those self-care, the self-care and the self-checkups, to maintain their weight and their nutrition, to reduce the stress. You know, talk about all those things that are those triggers that will certainly trigger a diagnosis, correct? But at the community level, being able to bring this information through workshops, through one-on-one conversations with residents, being able to provide information through resource events that we host. We host a monthly farmers market, and that is our great outlet on a monthly basis because we have about 50 people. So that's 50 households that we can distribute information. So we try to bombard them with as much information as possible, and always looking for opportunities to collaborating to be able to share this on an ongoing basis.
Thank you. Those are all great ways to share information, and all of the things and strategies you listed for making sure that you get screened. I also mentioned before we hear from someone else that Jen is going to share a social media toolkit. So if you just want to share like some information about getting screened on Facebook or whatever social media platform you use, we'll have that available to you as well. Does anyone else want to share how they plan to share some information? And you can think about it. That's the good thing. You can think about it. These resources are available and open to you. And I'm sure Jen will send out, like she said, a follow-up email with more resources from the American Cancer Society. But that's, oh, I'm sorry, was someone speaking? Oh, sorry. Well, that's all that I had. I'm going to turn it back over to Jen to close us out.
Well, thank you so much, Ashley. I know it's almost 10 o'clock your time. So thank you so much for taking your evening to share all this amazing information, educate us, bombard us with as many resources, allow people to share their own personal stories, as well as give their own ideas and just share their comments overall. So this is just the beginning. Obviously, we've mentioned multiple times that this is a series. We're really excited to launch it tonight, but we're going to be doing this quarterly as well as providing information throughout in between each session. So listed on the screen are the upcoming sessions. So next quarter is going to be Wednesday, April 6th at 6 p.m. They're always going to be in the evening to allow people the opportunity to join because we're all busy people. And we're going to continue to provide resources so that we can reach the larger community. So yeah, so thank you again. And before we close out, I want to give Cedric Spencer, representing California, Hawaii, NAACP, an opportunity to speak.
Thank you so much, Jen and Ashley. Thank you for your presentation this evening. Just on behalf of us, we just say thank you, and we greatly appreciate the opportunity to partner with ACS. The information provided this evening, just a wealth of information, and it allows us to be empowered when we go to see our doctor, as well as in the community when we're sharing information about cancer. So again, thank you so much. Greatly appreciate President Callender allowing us to partner with you, and also Selena and staff for working with us, making sure this happens. So finally, thank you, and have a good evening, everybody. And Jen, it's back to you. Thank you so much.
Okay, so I know it's, evening time for anyone, but if there are any final comments, questions, definitely feel free to ask that at this moment. Okay, I will take that as everyone just being really, oh, Selena.
I just love it when you're so thorough and no one has a question.
Right? Seriously. Okay, well, thank you to Ashley Brown for facilitating tonight's session, to Raquel Arias, my cancer control liaison, Primo Castro from ACS CAN, President Callender, Selena Pryor, Cedric Spencer with California, Hawaii, NAACP. And also, I want to take a moment to thank Dan Witzling, whose commitment to this work really helped to jumpstart this partnership and has led to this Train to Trainer series overall. So yeah, so thank you to you all. And lastly, thank you to everyone that took some time to join us tonight. We hope that you are leaving here inspired to arm yourself with the facts and resources, to share with the larger community, and above all, help us increase cancer screenings and raise awareness. So with that, thank you and good night.